Hi everyone. So another video today. I can see this question is in my WhatsApp group from one of a student. She says, "Ma'am, can you please tell us important topics to study from chapter number 70 in Saunders ninth edition? It's too much and very lengthy. If you can cut down something, it will be very helpful." Okay, so let's get started. Now, before you watch this video, have a book in front of you, everyone. Ninth edition book I'm referring right now, so you can open the ninth edition at the same time, okay? And it's a page number, if I see here, the page number for you, it's 1017. That is a page number for this book. So the first topic I can see here is on the IV fluids, and IV fluids, I already created a video on this one, so I don't recommend to read from here for the IV fluids, but you can read if you have time enough from here as well. But I would suggest looking at the video would be more visual for you rather than reading much information from here on the IV fluids. Even though this information I really appreciate, it's a good information in this book as well, but a lot of time when students they read too much, they just start forgetting sometimes stuff. So it's a good idea, watch the video on this one. And then in IV fluids, after you watch that video, see what else you need to know in the IV fluids here. But I don't personally recommend much to read in this topic, okay? Very less likely chance questions more on this one. And then after the IV fluids, the next one I can see here is on the okay, before I proceed to the next topic, I can see there is a page number 1020. They are talking about latex allergy in the letter L. So latex allergy, it's a good information to read it, and some of the questions it can helpful for you. And then after that, in 1021 page number, nothing much to read in here. But if someone is going for the LPN exam, then yes, you need to read the page number 1021, especially when to change the sites after how long. So that's more for the LPN. But if you're going for the RN examination, you don't need this information much for your those questions. And moving on to page number 1022, I don't see much information in here as well, again, to read it. But if you have some time, better to read the complications of the IV therapy, which is in the form of the box given. At least know the meaning, what is air embolism, what you can do in there, sign and symptom, nursing intervention, because if any case study comes or any question come in front of you, you really need to know how to recognize if this is the air embolism or what, and what are you going to do first, right? So I recommend this table, air embolism and then circulatory overload. You can read in this one. You can also read about the electrolyte imbalance and then infection. These are the important one I can see here. And then they're talking about, in continuation of the table in page 1024, infiltration phlebitis. Very important. You really need to know even the meaning of the infiltration and phlebitis as well, and what are you going to do in there. And then yeah, that's it. And then moving on to the page number 1025, I can see there is a PICC line, PICC line, peripherally inserted central catheter. Do this one also, okay? For the RN exam, for sure, you need to know this. And also, moving on to page number 1026, they're talking more about parenteral nutrition. No, I don't think so. This could be an important topic if you're writing exams soon. But maybe yes, for the future, if you have a lot of time to study, then yes, you can read that information. 1027, not even this one. And then you have 1028. No, nothing to read in here also, I don't think so. And then Again, for parenteral nutrition, I can see a box here on the complications. uh, if you have time, read this one a little bit, skim and scan. What could be the complications and what are you going to do there as a nurse, or what could be the signs and symptoms? And then home care instruction table on parental nutrition, which is a box number 70.5 on page 1030. Again, everyone, I'm just using this as a reference guide because it's a really good book. It's a Bible book. A lot of students are calling me and asking me, ma'am, do we need to read this book? The answer is yes. Okay, it's a really good book for your content. So if you have time, read this. But if you have less time, I'm already telling you important topics right now, what to study in this chapter. But if you have more time for your exam, better to read this chapter more, because I can see some more important information here as well. And then blood products they're talking about. This one I already put one video on blood transfusion. That should be good enough. But if you have time, as I said, you can read it. And then what else? 1033 is talking about nursing responsibility. Again, this is we covered already in our video, but you read this here if you don't understand the video, okay? So but don't do duplication, that will be a lot for you. And then page number 1034, I can see clinical judgment box, really good. Read this one also. And then you don't have to read types of tubes, intubation procedures. Not really. You need to know how to put it. Well, practicum, yes, after passing the RN exam, when you're working on the floor, you need to know all these things. But again, this video is only for reference for the NCLEX examination, okay? Only for the exam purposes. And then I don't see any important others still so far, so you can just delete everything if you don't have enough time much to study until you test. And then page number 1039, 40, nope. 1041, nope. And then suctioning, you need to know the procedure, which is on page number 1043. Know the suctioning procedure a little bit, and also what could be the complications as well. Regarding complications, don't study too much into depth, just skim and scan, okay? A little bit about the symptoms and how you can prevent it. So just brief information, not too much. And then they're talking about the chest tubes here, which I can see on page number 1044 and 45. This one, I have the respiratory system video coming up soon on this, if you want to learn from there. But if you're writing the test very soon and my video is not uploaded yet, then you can also do from here as well, okay? This is really good information. And then page number 1046, burn. I can see rule of 9, yes, important. So you need to know this one too. But do we have to study everything about the burn? I would say just stages and rule of 9. Not much nursing interventions in detail, like Parkland formula and everything. I don't personally recommend it until unless you're going for PN examination, okay? And then page number 1048, nothing much in here. 1049, nothing much in here as well. No, you can totally skip all these pages until I see the next page. Okay, the next one I can see here in 1053, they're talking about like SIADH, you know, some other conditions like after hypercalcemia. This one you already done in the medical surgical, so don't duplicate everything here, okay? If you already know in there, then don't read it from here. Again, endocrine problems. If you already know endocrine system really well in medical surgical, do not duplicate in this one in here. Again, same thing for GI. You can skip everything. Respiratory, if you already read those chapters in the medical surgical before. Okay, so you don't have to read the double. And you don't need to know the types of mask in here, but of course for practicum you need it, but not for the right now, as I said, for your theory paper for the NCLEX. And then ventilators, you need to know for sure for your NCLEX, page number 1062. So high pressure alarm, low pressure alarm, you need to know. And then after that, they're talking about cardio and other systems as well. Again, you only read this if you need it, but if you already read this craniotomy everything before in the medical surgical, do not duplicate, I would say. Yeah, that's all I can see until here. I'm already at page number 1078, 1079. Yes, you need to know sepsis and shock. If you never read that before anywhere, it's better to read from here. But if you know already everything in, then you don't have to duplicate, as I said. And that's all about for this chapter now. Okay, so I hope I simplified the chapter number 70 for you in the 9th edition of the Saunders. But yes, the questions at the back of each chapter, I always say in Saunders, very, very, very important. Do not skip the questions as well. You really need to practice them. And once again, that's all about for this unit. If you do have any other questions still after reading this chapter, maybe you do not understand the topic, or you do have further question, put in the comment below of this video so I can address it for you. Thank you so much.